In this introductory program entitled Laboratory Skills, you will be introduced to many of the fundamental skills necessary to assist in a veterinary laboratory. Though there will be many things you will not learn in this abbreviated program, you will gain an understanding of the following: proper collection of blood samples, performing various blood tests, and the use of equipment to test blood samples, collection and evaluation of urine samples, and finally evaluation of the stool or feces for internal parasites. A veterinary lab is a fascinating area in which to be involved. When a sick patient comes to your hospital, they are unable to voice their illness as we might do. Instead, veterinarians rely on the use of diagnostic tests, along with a thorough physical exam and an accurate history from the owner to uncover the exact illness the pet might have. The diagnostic tests veterinarians perform often include evaluating tissues and fluids of the body. Blood, urine, and feces, the three specimens we will study in this program, often reveal amazing amounts of information to the veterinarian as to what is happening within the sick pet. You play a valuable part in this detective work by accurately conducting these tests. Your role is to understand how to perform the tests, while the veterinarian's role is to apply their many years of training and experience into interpreting the results. This program does not attempt to train you in interpreting the results, only proficiency in running the tests. Together with the veterinarian, you will be helping to diagnose diseases, many of which can be effectively treated. In most dogs and cats, blood is collected from one of several veins. The cephalic vein on the leg is used when small amounts are needed, and the jugular vein on the neck is commonly used when larger samples are needed. This blood is collected into a sterile syringe and immediately deposited into one or more blood tubes called vacutainers. These vacutainers, as the name implies, contain a vacuum that sucks the blood into the tube once the syringe penetrates the stopper. The color of the rubber stopper provides a quick means of identifying if any added chemicals are present in the tube. The lavender top tube contains a chemical called EDTA that prevents blood from clotting. Blood must generally be placed in this tube relatively quickly, as blood will often clot within a minute or two of being drawn out of the vein. Once the unclotted blood is mixed with the EDTA, it will remain as unclotted whole blood, meaning all of the components of the blood are still present. The other tube that is quite commonly used is the red top tube. This tube does not contain any chemicals, and therefore blood will naturally clot within several minutes after collection. Blood contains solid components, mainly red and white blood cells, and a liquid component called serum. Clotted blood cells in a red top tube can be separated from the serum by placing the tube into a machine called a centrifuge and allowing it to spin for 5 to 10 minutes. Always be sure to balance the sample with a similar quantity of water or blood on the opposite side of the centrifuge. This is necessary to keep the instrument spinning smoothly and in balance while spinning. This spinning forces the heavier blood cells to the bottom of the tube and leaves the serum at the top. This process is necessary because it is the serum that contains many of the chemicals produced by the organs. Some red top tubes contain a separating gel that forms a layer between the cells and serum upon centrifuging. This often makes the serum more stable for transport or a bit easier to remove from the tube. The red top tube will sometimes contain a piece of paper or plastic that stimulates and speeds up the clotting process. Other tubes used in veterinary labs contain various chemicals, giving each one a different purpose. When submitting a blood sample to a veterinary lab, you will need to consult the lab manual to determine which tubes they require. For example, an immune profile requires a blue top tube, along with a more common red top and lavender top tube. Manuals will generally indicate the amount of blood the laboratory needs to run the test. It should be emphasized here that utmost safety should be practiced when dealing with uncapped syringes and potentially infectious blood. Always be careful not to inadvertently stick yourself while handling a sharp needle. Special safety holders have been developed to reduce the risk of sticking yourself while inserting the syringe and needle into the vacutainer. You should always immediately dispose of the needle into a sharps container once the blood has been transferred. Next, we will focus on the basic tests that are performed with the various blood samples. The most commonly run test performed on whole blood in the lavender top tube is the CBC. The CBC, or complete blood count, measures the number of red blood cells, white blood cells, and platelets in the sample. Such information helps the veterinarian assess such things as anemia, or reduced numbers of red blood cells, dehydration, infections, and many more disease conditions. How do we go about counting such cells? The original method was to count the cells by hand with a microscope using a device called a hemocytometer. This device requires a great deal more training and time, and therefore has often been replaced by machines that automatically count the cells. The most common machines that do such counting include the Coulter counter, the QBC Vet Auto Read, Heska's Vet ABC Diff Hematology Analyzer, and others. Operating these units is relatively easy to learn, and they provide fairly accurate counts or estimations as to the number of blood cells present within the animal. Commercial veterinary laboratories routinely and inexpensively perform CBCs as well. When submitting blood to a lab for a CBC, you will need to prepare the appropriate lab form, being sure to include all of the necessary information needed pertaining to the pet, the owner, and the hospital running the test. They will also need a small amount of blood in a lavender top tube, generally 1/2 to 1 cc. They may also request 1 or 2 quality blood smears. Such smears are made by placing a drop of well-mixed whole blood at one end of a clean microscope slide. This small drop of blood can be taken off the rubber stopper, as just demonstrated. With another clean slide, back the edge into the drop of blood, allowing it to spread along the edge. Immediately after this has occurred, push the slide forward. This will evenly distribute the blood. The angle and speed are very important variables in creating a clean blood smear. A good smear will result in a curved, feathered edge with even blood distribution. After a second slide is made, the slides are set aside to dry. They can then be inserted into a slide case, such as the one shown here, and sent along with a lavender top tube to the lab. Most labs pick up samples from veterinary hospitals on a daily basis and will call or fax the results back within 24 hours. An abbreviated version of the CBC, called a packed cell volume or PCV, evaluates primarily the red blood cells, which constitute the majority of blood cells. This test provides a quick screen to let the veterinarian know if the patient has an adequate number of red blood cells. Follow these steps when performing a PCV. First, allow a drop or two of unclotted blood to be wicked up into a hematocrit tube, as shown here. When the blood has reached the fill line, stop the filling by covering the open end with your fingertip while removing the other end from the blood source. Next, place the end of the tube into the clay material, being sure the end is adequately sealed. The hematocrit tube is now ready to be spun down in a microcentrifuge. The final step is to read the results. This is done by placing the hematocrit tube onto a special card designed to tell us what percentage of solid blood cells are present. Note that the top edge of the clay is set to the 0 line, and the top edge of the plasma aligns with the 100% mark. The tube will need to be adjusted to the right or left to find the appropriate reading location. The result is read as the number where the blood cells and clear fluid come together. In this example, the PCV is 50%.